Hello friends. Let us talk about ocular effects of some common systemic diseases. Systemic diseases are diseases that involve many organs or the whole body. Many of these diseases also affect the eyes. In fact, an eye examination sometimes results in the first diagnosis of a systemic disease. The eye is composed of many different types of tissues like connective tissue, epidermis, nerves, vessels and smooth and skeletal muscular tissues. This unique feature makes the eye susceptible to a wide variety of diseases. Almost any part of the eye can give important clues to the diagnosis of systemic diseases. The outer parts of the eye like eyelids, conjunctiva and cornea. The middle parts of the eye like iris and lens. The back part of the eye, that is, retina. The optic nerve and eye movements often reflect changes in the central nervous system. This is because 50% of the cranial nerves are supplying to the different parts of the eye, controlling different functions. Because the eye structures are transparent, a doctor can see inside the eye and visualize the blood vessels directly. The health of the blood vessels in the eye often indicates the condition of the arteries and veins in the other parts of the body. Systemic diseases most commonly affecting the eye. Diabetes mellitus. Acquired immunodeficiency syndrome, AIDS. Graves' disease. Sarcoidosis. Systemic lupus erythematosis. Rheumatoid arthritis. Hypertension. Atherosclerosis. Sickle cell disease. Multiple sclerosis. Diabetes mellitus is an imbalance in blood glucose levels. Diabetes can cause severe ocular complications like macular edema, abnormal growth of new retinal blood vessels, bleeding inside the eye. Changes in the blood vessels of the retina or fluctuations in vision sometimes lead to the first diagnosis of diabetes. Diabetic retinopathy is one of the leading causes of preventable blindness in this country. In addition, people with diabetes develop cataracts earlier than other people. Therefore, it is important for diabetic patients to have regular eye examinations. Acquired immunodeficiency syndrome. A life-threatening disease caused by a virus that cripples the body's immune defenses. AIDS can cause infections in the eye, retinal detachment, eyelid tumors and neuro-ophthalmic disorders. AIDS-related infections can often lead to blindness, but effective eye treatment is now available. Abnormal retinal circulation is another frequent complication of AIDS. Sometimes, the first signs of AIDS are abnormalities in the retina. Graves' disease. A thyroid disorder which can cause a goiter, swelling in the front part of the neck. Graves' disease can cause protruding eyes, that is, proptosis, limitations of eye movement, double vision and corneal disease. Severe cases may have damage to the optic nerve. Sometimes the eye symptoms in Graves' disease can appear before other symptoms and signs. Sarcoidosis. A disease that mainly affects the lungs, brain, joints and eyes. The structures in the eye are prone to inflammation. A type of inflammation called uveitis is the most common eye problem caused by sarcoidosis. Uveitis can result in painful and red eyes, blurred vision and glaucoma. Systemic lupus erythematosis and rheumatoid arthritis. Systemic lupus erythematosis is a connective tissue disorder involving mainly the skin, joints and kidneys. Scleritis, an inflammation of the white part of the eye, can result from systemic lupus erythematosis and rheumatoid arthritis. Both of these conditions also can cause dry eyes. Hypertension. High blood pressure and atherosclerosis can damage the retinal blood vessels. Usually, this damage does not result in any visual symptoms at first. However, it can eventually lead to more severe complications in the retina as well as in the body. In persons with high blood pressure, the extent of damage in the eye can directly relate to damage that occurs in the kidneys. High blood pressure can be first diagnosed when changes in the blood vessels of the eye are found. Sickle cell disease. An inherited blood disorder that can block circulation throughout the body, primarily affecting African Americans. Sickle cell disease also can cause abnormal retinal vessels as well as bleeding inside the retina. Sickle cell eye disease can sometimes lead to blindness if not treated with laser therapy. Multiple sclerosis. A disease that damages nerve coverings, causing weakness, coordination and speech disturbances. Multiple sclerosis can cause eye movement problems, as well as optic nerve disease, causing loss of vision. Neurologic diseases such as multiple sclerosis may be first suspected when an eye doctor finds changes in eye movement, vision or the function of the optic nerve. Carcinoma. Cancer can start in the eye or can spread to the eye. Tumors of the eye are not seen often, however, depending on its location, an eye tumors may or may not distort vision at an early stage. Early detection and treatment of cancer in the eye can be vision-saving, and in some cases, life-saving. Brain tumors also may affect vision by causing swelling of the optic nerve. Occasionally, a doctor may first suspect a brain tumor after finding optic nerve swelling on an eye examination, or as a finding in visual fields. Treatment. For any of the systemic problems mentioned above, it is important to have an eye examination by an ophthalmologist. Forms of ophthalmic treatment are drugs for inflammatory diseases, laser therapy for retinal vascular diseases, surgery for tumors, combined procedures. The ophthalmologist, working with other healthcare specialists and your family physician, often plays an important role in treating systemic diseases.